Thank you and good afternoon. Let me share my screen here with you. I don't see my screen here. Okay. I am delighted to have the opportunity to show you what the WHO Academy has been doing on the mobile learning front in response to the COVID-19 pandemic. The emergence of the pandemic early this year, of course, raised the urgency for knowledge and information to be conveyed to health workers. And it generated urgent demand across WHO member states for high-impact digital learning. This was precisely what we at the Academy were working on, meeting the growing demand for digital and scalable learning solutions and systems to improve global health. So in response, we created a mobile learning app specifically for health workers, which I am proud to talk about today. The app supports them as they treat patients, save lives, and protect themselves from infection as they do their critical work. But before I get further into that, let me first talk a little bit about the WHO Academy itself. The WHO Academy is scheduled to launch in May 2021. It's a special initiative of WSO's transformation and will be the World Health Organization's state-of-the-art learning center. We are deeply grateful to France, and in particular to President Macron, for their commitment, investments, guidance, and overall support in realizing the vision of the WHO Academy. It has all been vitally important and is making the Academy possible. And we look forward for 2023 when we will open the doors of the Academy's hub and state-of-the-art campus in Lyon, France. Our key ambition for the Academy is to improve the speed, efficiency, effectiveness with which information and guidance gets to the health workers, public health officials, policymakers, and others. The WHO Academy will address this problem by delivering high-quality, multilingual learning, both online and in person, through one of the world's largest and most innovative digital learning platforms, enabling users to tailor their learning and receive digital credentials to verify the competences they gain. We are aware that less than 5% of countries were on track to achieve the Health Sustainable Development Goals. And during the COVID-19 pandemic, 90% of countries have reported disruptions to essential health services. Further to these, advancements in the health sciences are growing exponentially. But the latest knowledge and evidence-based guidance needed by health workers and others to improve outcomes is not getting to them quickly, efficiently, and effectively. It often takes more than a decade to put important life-saving guidelines into actual practice. And meanwhile, the science and knowledge surrounding COVID-19 is doubling every 20 days. So the WHO Academy seeks to help address this problem by bringing the very latest lifelong learning innovations to the global health sector. The Academy will be a game changer in scaling up new skills and knowledge for global health impact. In addition, the Academy will also be a powerful professional development tool for WHO that will help us fulfill our mandate as a learning organization by strengthening the competencies of all our WHO workforce. Let me talk about the COVID-19 mobile learning app for health workers, which is why we are here today. Every week, WHO puts out a great deal of guidance, literature, and other information related to the pandemic. As I said a moment ago, COVID-19 has raised the urgency for this knowledge and information to be conveyed immediately to health workers. And as evidenced by the fact that we are forced to meet online for this forum, for example, we have to depend increasingly on digital communications and remote learning in a pandemic situation. So our WHO Academy team worked quickly earlier this year to create a response, an innovative learning tool that health workers could find convenient, useful, and which will help them treat patients, save lives, and keep themselves safe from infection. So we developed this mobile learning app, which is now available for every health worker with a smartphone. It delivers a wealth of COVID-19 knowledge resources developed by WHO, including up-to-minute guidance, tools, trainings, and virtual workshops. Importantly, this is a global app, so we have made it certain that it's available in multiple languages. So far, we're covering the 6 official UN languages plus Portuguese. So why did we take this approach? Why build a mobile app for health workers? Well, first of all, we decided to ask health workers themselves what they needed and what they thought would be helpful to improve their knowledge and competencies. We surveyed more than 20,000 health workers around the world. And what did we find? Well, first, they clearly indicated they needed and wanted to learn more about COVID-19. Not surprisingly, perhaps, but the proportion that they felt needed more skills was very high. About 2/3, 67% felt they needed more skills to be fully prepared for COVID-19. Secondly, they said they trusted WHO's information and guidance, and they already use it. And again, 2/3 of those we asked responded this way. More than 3/4 also said that what they needed was more access to virtual learning. And this is important. We found that by far, the mobile phone or tablet are the most popular type of device for getting information from the internet. 83% of health workers we surveyed use a smartphone or tablet. That's compared to only half of respondents who use a laptop and 1/3 who use a desktop computer. Then there are the areas where they felt they could improve their skills. Here on the left side, you can see the topics that were mentioned the most out of a fairly long list. And you can see infection prevention and control, case management, use of personal protective equipment, staff safety and health, risk communication. And these were the top areas they asked for support. The app, sorry. The app has other key topic areas as well. So it covers also epidemiology, laboratory, maintaining essential health services, international health regulations, research and development, operation support and logistics, and global networks. So it's very comprehensive. The app also features workshops, webinars, and other online events that users can access directly from their phones. There is a news update featuring the latest COVID case numbers and news releases. There is a global literature section including papers from around the world organized by topic. And there is a section with basic information on the pandemic for a more general audience. On infection prevention and control topics, the app carries a structured frequent asked question feature that offers users the opportunity to ask their own question, and the WHO expert responds to them personally via email. Now, when we get enough questions exactly the same, these are added to the frequently asked questions. Now, here's something we're very excited about. This week, through our mobile learning app, we launched the WHO Academy's first course. It's a 20-minute learning experience for health workers on the proper procedures for putting on and taking off their personal protective equipment, what we call PPE. As you may know, it is vitally important that those who are using PPE follow the guidelines to the letter. Even small mistakes can greatly increase the risk of catching or spreading infection. Globally, there are 43 million health workers who need this precise, approved training to protect their own health and safety in the presence of infectious diseases. Many do not know these procedures, while others could use a refresher course. So we have created a 3D augmented reality interface. We have created a tool that delivers a more immersive and effective experience for the user. Augmented reality is a technology that provides the learner with an interactive experience on a real-world environment. In the case of this PPE course, which is delivered through the WHO Academy app to a smartphone, the lifelike human figure that is demonstrating proper use of PPE appears to be present in the room or space where the learner is at that moment. You don't need a special headset to view it. The demonstrator appears right on your smartphone screen. As the course plays out, the learner can move 360 degrees around the figure to closely observe what it is doing and to direct its movements. Once the learner completes the course and passes a test administered through the app, they are awarded a digital credential by the WHO Academy that is attached to their personal identification. Studies of adult learning outcomes have shown that immersive learning experiences supported by augmented reality and similar technologies are more effective and enabling individuals to learn faster and more effectively. So we are now just launching this course and are expecting that it will be widely used by health workers around the world as more become aware of it and how easy it is to assess and use. And I'll just take the opportunity now to show you a small video on these.
Welcome to the WHO Academy's AR PPE training. That's it, putting on your PPE.
So as you could see from the video, this augmented reality experience was developed by the WHO Academy in collaboration with Facebook and Nexus Studios. And I hope the video actually gave you an idea of what is augmented reality technology and how is it being used to create the learning experience for health workers. Although you do have to have the WHO Academy app on your smartphone in order to get it. So here are some of the QR codes for downloading the Academy app into your smartphone. I'd encourage everyone to download it, try out the PPE course, immerse yourself in the augmented reality experience, and after you do that, then explore the other areas of the app and see what's there. And then tell everyone you know about it. Just disseminate it. I leave these codes here while I take your questions, and thank you very much for your interest. Now, I see I have already a few questions on the chat. First one is, has the application been downloaded a lot since its creation? In which countries is the app most successful, and which context do you think it's most useful? I'll start by saying that the app currently has around 80,000 downloads. It has been downloaded in every single country and territory of the world. Countries right now, the countries who had the most uptake of the app were the United States, Nigeria, Egypt, um, and the list is growing, but these are just the top ones. Um, and in which context do we think it's most useful? Well, this is super useful for any health worker that needs to take contact and droplet precautions to deal with not only COVID-19 patients, but any other respiratory disease that would require the same type of precautions. Second question was about, does the app also provide mental health support to health workers, and how do we promote it? Well, the app does contain information elaborated by WHO on mental health issues and the way they are related to COVID-19. It does include health workers and other staff in general. It's been promoted right now. It's been promoted through our different communication channels within WHO, and we're also using this opportunity here at the Paris Peace Forum also to promote it. Question 3, does the app also develop mutual aid between health workers, peer learning opportunities? Well, not at this stage. Although the learning experience platform that is currently being developed by the WHO Academy will have that feature of networking and peer learning opportunities. Question 4, what other innovative tools has the WHO developed in response to the COVID-19 crisis? Do you think that the digital training through app, etc., can replace face-to-face training in the health sector? Well, it's a very good question, and actually different sets of tools have been developed by WHO during the pandemic, not only by the Academy, but also by other departments within WHO. So, for example, there is a WhatsApp messaging system that allows you to interact and get response to frequently asked questions and know, for example, numbers of infections and trends. We have the app here, and we're also disseminating through Facebook also a chat that allows everyone to remain connected and get the latest news on COVID-19. Now, can these replace face-to-face training in the health sector? That's probably a $1 million question. We do believe that some competencies can be trained using digital tools. Some of competencies will have to be, of course, acquired on face-to-face training, but as much as possible, we're trying to expand and make sure that the competencies that can be provided through digital learning are being delivered through digital learning. Question 5, do you think you can improve the application, provide new contents? Do you also give updates on the development of vaccines? Yes, so the application is being constantly being developed. Actually, this is version 5 already of the application, and new features are being added on a regular basis. New contents are added on a daily basis. So every time, if you have the application with you, every time new contents are added, you will receive a notification on your phone that new content is available, and you will be taken to that new content that has been delivered. In terms of updates on the development of vaccines, yes, you will find within the application a lot of information regarding vaccines and the current development. I will, for those who didn't have the opportunity, I'm sharing my QR codes again. So if you have your phone in front of you, so if you use an iPhone, you scan the code below, that's for the App Store. And if you use an Android phone, you can scan the upper right QR code, and that will take you to the Google Play Store. If there are no other questions, I thank you very much for your participation. I hope you enjoy it. I hope you disseminate the app, and especially now these new augmented reality training for personal protective equipment. Thank you very much.